Sarcoma is a cancer of the bones and the soft tissue, such as the fat and muscle, and it's often treated firstly with surgery, where the surgeon tries to remove as much tissue as possible. But often some cancer cells remain behind, and in time these cells can grow out again and cause the cancer to recur. We can treat children with sarcoma with chemotherapy and radiotherapy, and we do to prevent that from happening. But unfortunately that comes with very severe side effects from time to time, and also it is not as effective as we would like it to be. Still, 1 in 3 children with sarcoma die of their disease. Now we're developing a gel that the surgeon can apply during surgery at the site where the tumor used to be. And after applying the gel, the surgeon just closes the wound like normal and the child can go home. But in the next period of time, this gel slowly releases immunotherapy, attracting immune cells and activating them locally to mop up any remaining cancer cells. The gel itself is degradable, so after a period of time the gel is gone and hopefully so are the cancer cells. Immunotherapy is different from chemotherapy or other cancer drugs that really target cancer cells. Instead, we're now targeting the immune cells. We're boosting their activity and their ability to recognize cancer cells and destroy them. Radiotherapy and chemotherapy can have severe side effects. They're targeting not only the cancer cells themselves, but also healthy tissues around it. And children can have sometimes lifelong side effects from these treatments, such as learning problems or infertility. And immunotherapy doesn't have these drawbacks. Because we're targeting the immune system and not so much the cancer cells themselves, we let the immune system do their own job and recognize the cancer cells. We expect that it could also be applicable to other cancers, not only sarcoma. So surprisingly, sarcoma is also one of the most common cancers in pet dogs, and it presents exactly the same way as it does in children with sarcoma, which is a lump in the tissue, often muscle or a bone, and the treatment is exactly the same. You want to surgically remove it, and similarly like in children, unfortunately that in itself is often not enough. So some cancer cells remain behind and they can grow out again. So the same problems arise there, both surgically as well as medically, and so it's the perfect setting for us to test whether this gel can actually make a difference without causing any side effects. We offer owners of pet dogs the opportunity to participate in a clinical trial, so hopefully that will benefit their dog. They are also participating with the knowledge that in the long term it may even benefit children with sarcoma. This is a world-first clinical trial happening right here in Australia. We feel this is a new, exciting treatment approach that doesn't have the side effects that come with the standard of care therapy that there is now, like chemotherapy or radiotherapy. We hope in the next few years that we can see this treatment enter clinical trials in humans. This has truly been a collaborative effort with our partners and supporters, and we couldn't have done it without them.